Here we go, brand new edition of Sports Medicine Weekly on this Saturday morning. How you doing, everybody? Steve Kashul, your Chicago Bulls radio host, joined as always by my co-host, Dr. Brian Cole, head team physician for the Chicago Bulls, one of the team physicians for the White Sox. He's a sports medicine specialist, orthopedic surgeon for Midwest Orthopedics at Rush. How are you, Doc Cole?
Doing great, Steve.
Good. I want to get into it right away and talk about shoulder subluxation, all right? Byron Buxton, love that name. It's like kind of a Chuck Swirsky name. Byron Buxton. He's a twin center fielder, and he subluxed his shoulder, crashing into the outfield wall. It's some interesting video if you look up CBSSports.com. But my question is, what is a subluxation?
So a subluxation is a partial dislocation. So you may say, well, what's a dislocation?
Yep.
So a dislocation is when the joint becomes dissociated. In other words, in the shoulder, which is a very inherently stable ball and socket joint, the golf ball, which is the humeral head, comes off the tee, which is the glenoid. So it literally, they're not rubbing on one another, they're completely dissociated. That's what a dislocation is. And the most common cause of that would be a traumatic event where the arm is placed in a very provocative position, forcefully externally rotated, and the arm is just basically levered out of the socket. Very painful, often results in a trip to the emergency room the first time, and a physician will have to put it back in place by pulling on it forcibly in a sedated patient. That's a full dislocation.
Do the trainers, like in baseball, can they put it back
too?
I
mean, dislocations in baseball are pretty rare. We'll see them with a baseball player who slides with the arm out, so arm first, for example. You'll see it in football and basketball. Remember Joakim Noah dislocated his shoulder on TV. So did Dwayne Wade and a couple of other guys, right? So it can happen in basketball. But a subluxation is a partial dislocation. In other words, there's just enough force to move it slightly out of position, and the athlete will say, hey, I feel like my shoulder almost got out of position, but it went right back in. And we've seen some of these before in both MLB and in basketball. A little less of a problem. Lots of times that it's sort of a shock and awe thing, lots of discomfort, and the muscles around the shoulder will shut down, and then it gets better very quickly. Rarely results in the need for surgery. So that's when the shoulder doesn't completely come out of place. It's an incomplete dislocation, and it's otherwise known as a subluxation, or a partial temporary dislocation. Goes right back into position.
I got a question for you. Does a subluxation make somebody more likely to have a dislocation in the future?
I think I could argue that I do see patients who say, look, I felt like my shoulder used to partially come out, now it completely comes out, but there are often two different categories or ends of the spectrum for shoulder instability. So I would say it is not categorically true that people who have partial instability of the shoulder end up having shoulder instability to the point where the ball and socket become completely dissociated.